Libya, Syria and Yemen are bracing for a possible coronavirus outbreak. Officials there have shut down schools and imposed travel restrictions. But how can this virus be contained in conflict zones? And can developing nations cope with a pandemic? This is Inside Story. Hello and welcome to the program. I'm Darine Abugaida. From complete lockdowns of cities to building new hospitals, rich countries appear to be better suited in the fight against the coronavirus pandemic. But COVID-19 is straining health systems and some governments are struggling. And this raises fears that nations whose hospitals are closed or ill-equipped may not be able to cope. Conflict zones are of a particular concern. Libya's UN-recognized government in Tripoli has declared a state of emergency. It's ordered the closure of its land, air and sea crossings as well as schools for 3 weeks. Yemen's Saudi-backed government has suspended all flights to and from airports under its control for 2 weeks. And Syria has delayed its parliamentary elections and cancelled most public events. But it's not just conflict zones. The Palestinian Authority has declared a state of emergency in the occupied West Bank, while Lebanon, which is in the midst of an economic and financial crisis, is expected to do the same. Afghanistan has closed all schools. It's cancelled sporting events. It shares a border with Iran, one of the worst affected countries. And over in Africa, countries there have so far been largely spared from the worst of the pandemic, but their numbers are slowly increasing. Kenya, Ethiopia, Sudan and Guinea confirmed their first cases on Friday. And experts fear nations with an already weak healthcare system could struggle to cope. The Red Cross says that includes countries like South Sudan, the Democratic Republic of Congo and Central African Republic. We'll bring in our panel in just a moment, but first we're joined by Dr. Ihsan Aidi, who's a cardiologist at a hospital in Syria's northern province of Idlib. Dr. Ihsan, thanks very much for speaking to us on Inside Story. So, of course, officially, Syria has so far not recorded any coronavirus cases. In your assessment as a doctor, though, what is the risk of an outbreak in Syria, and particularly where you are in Idlib?
Now, I'm living in the northwest of Syria, Idlib, and it's somehow isolated from the outside world, but just a few numbers of people could cross the border to Turkey, go and come, and also the border with the regime area are nearly closed, but some people also can go and come there. So if we are going to get it, there are two sources, from the regime area and from the Turkey.
How worried are you at the possibility of an outbreak? Is that a real concern of yours?
Of course it is, because we here have so many crowded camps with unhealthy circumstances. Also some cities are so much crowded at the northern area near the border with Turkey, as people who were displaced from Saraqib, Al-Mara, and cities near these are living there.
Yeah, we've often reported on the state of hospitals in Idlib, where you are, which, of course, as you're saying, have suffered due to years of war. So what would an outbreak then mean for the hospital's ability to provide care?
We know that hospitals there are not that hospital compared to those in developed worlds. They are new hospital and they are working in bad circumstances. The resources are rare. The consumables which we need are not all, available all the time. So if such outbreak happens, in fact, we can't do so much to prevent it or to control it. We don't have wards available to isolate patients, suspected or proved patients. We don't have facilities to prove the disease. We know if it happened, many people will suffer from it, and those patients should be treated, should get nebulizers. Many patients will suffer from respiratory failure, and it's the main the West, because they need ventilators, and we already don't have these. For example, our hospital with the ICU unit just got one ventilator, and it's not working in a proper way.
What about the most basic recommendation when you hear the advice from the World Health Organization, for example, that people just must wash their hands? How difficult is that simple thing to do in Idlib, where you are?
It's not so much difficult, but if you want to advise all people to do these advices, it's not easy. In fact, you know, we try to educate people about corona and its ways of spread, and try to assure them that it's not so much a dangerous disease. And in fact, it's not a dangerous disease, but the problem that it spread in a horrible way. So if it started, the problem in stopping it, washing hands, keeping far away from patient with the respiratory tract infection, with the suspected corona disease, COVID-19, is the ways to prevent it. But how could we convince people to take these measures, especially those people who live in the crowded camps where hygiene is not good?
Right. Okay, we'll leave it there. We thank you very much, Dr. Ihsan Aidi, for speaking to us from Idlib. Thank you.
Thank you.
Let's bring in our panel now. In Beirut, joining us via Skype is Joelle Bassoul. She's the Middle East and Eastern Europe media manager for Save the Children. Also on Skype from Rome, Claudia Gazzini, a senior Libya analyst at the International Crisis Group and a former policy advisor to Ghassan Salameh, who served as head of the UN support mission in Libya. Welcome to you all. Thanks for joining us on Inside Story. Joelle Bassoul, I'll start with you. And the reporting nowadays has been mainly focused on countries in Europe, which the World Health Organization is describing as the epicenter of the virus. But let's look at conflict zones, and particularly the Middle East region. Which countries are the most vulnerable when it comes to an outbreak of coronavirus?
The two most vulnerable will be definitely Syria and Yemen. So far, they have registered 0 cases. Yemen has shut down its borders. Syria, obviously, it's a different scenario. But in case we have any registered and positive corona cases, we just can't imagine the outcome for millions of people who have been displaced internally by years and years of war.
And how would this outbreak affect these people? I mean, how defenseless are people living in environments that include war zones and refugee camps?
The main issue is specialized services. In Syria, for example, half of all doctors have left the country since the war started 9 years ago, and today we're starting the 10th year. In the Northeast, for example, the emergency threshold would be 10 beds for every 10,000 people. We're very far from this figure. In the Northwest, in Idlib, recently we saw massive displacement of populations due to 3 months of airstrikes and military offensive. So those civilians, women and children, are living in overcrowded camps, and you can imagine if there's an outbreak, what would self-isolation look like? It's practically impossible.
All right, we'll get into a little more detail about the camps in just a moment, Joelle, but let me cross over to Claudia Gazzini, bring you in from Rome. Of course, Italy being one of the hardest hit countries over in Europe, but I'd like to talk to you about Libya, because according to reports coming out of Libya, Claudia, officials there are saying that the coronavirus has started to pose a direct threat to the country, and officials are warning of its imminent outbreak. What are you hearing from the ground about what's going on?
I mean, officially, authorities still claim that there is no case of coronavirus, but they have taken measures. In the past 2 days, they've decided to close down schools, both in Tripoli-controlled areas in the west of Libya and in eastern Libya, which is under the control of General Haftar. So both sides have agreed to close schools. They've also agreed to close cafes. I was in Libya 3 weeks ago, and actually I was very surprised to see that already then in airports they had started coronavirus checks upon landing, even before Italy started to implement this. So this was surprising. But there is a danger that if there were to be a case, then the health system in Libya, which is already terrible in the Gaddafi era, ever since has not been able to get back on its knees. The health system will literally not cope with this.
Yeah, I mean, can you elaborate on that a little bit? So what do you mean they won't be able to cope?
Well, public health care in Libya was already abysmal for basic services. Vaccines were very often missing. Maternity wards were scarce, even in across the country, even in non-war days. Many of the nurses in Libya's health system traditionally are foreigners. Many used to be Filipinos. They started to flee the country about a year and a half ago, 2 years ago, because of the economic downturn and because of the increase of hostilities. So we don't have, so the health system now can only rely on local nurses. There's no foreign medical staff in Libya providing services, and public hospitals are, barely have intensive care units. So many Libyans, those who are wounded, those who are seriously ill, normally just go abroad for treatment. Now, with the borders closed, with the health system in Libya being what it is, these avenues of intensive care provisions will not be available if we were to see a serious outbreak.
And just to add on to what you were saying, I mean, this is one statistic from the Global Health Security Index, which rated the health security of 195 countries around the world. And when it comes to Libya, it's at 111 out of 195 when it comes to early detection. So detecting the coronavirus sounds like it would also be a worrying problem.
Yes, I mean the labs, simple blood tests in Libya until now are not in mint condition. The arrival of health kits or detection kits is very slow. Let's also remember that this is a country that is politically divided between two rival authorities. So even the health ministry and health system is victim of this political feud, and therefore it'll be difficult to coordinate deliveries of special equipment or extra intensive care equipment. And therefore, the testing for positive cases and taking care of those that are considered infected will be a challenge. They have started. In eastern Libya, I know individuals who have been tested, mainly because they came in from abroad, from countries that have showed positive cases, but they certainly do not have the means to do this in large quantities.
Joël Bassou, Claudia was talking about some of the preventative measures over in Libya, and we've seen these preventative measures being implemented in countries around the world. For example, the suspension of activities as well as restricted movement and access. But if you implement those measures in refugee camps, then the knock-on effect will be that it will actually affect humanitarian work. That's what the reports seem to suggest. That must be a real concern for organizations like yours.
Yes, absolutely. I mean, especially in the case of Yemen, for example, foreign aid workers need to fly into the country to be able to develop programs and implement them and support the civilian populations. If travel restrictions and travel bans are in place, it does have an effect on our own programs. We have teams in country, we have Yemenis on board of our teams, and it's the same in Syria, but still we still need to have this external expertise come in. In IDP camps, in internal displaced people camps in northwest Syria, we rely totally on Syrian aid workers, but they themselves have not necessarily been trained to face a corona outbreak.
So how will you deal with this situation? How will Save the Children and deal with this?
In the case of Syria, we're preparing plans with our partners in the northwest and directly in the northeast, and other international agencies on the ground to be able to face an outbreak. So, for example, we work mostly with children and their families, and we need to ensure that if an adult in the family is tested positive, how we can make sure that the children are taken care of, that the adult is in isolation, but that it doesn't affect the family's survival. As I said, the recent displacement in the northwest have left many families in need of the simple basic aid for daily life, whether it's food, shelter, clean water. And clean water is very important with soap to face an outbreak of corona. So if we cannot truck water to people in displaced camps, it will be an issue. So it's several layers of challenges that we need to tackle together. And I mean, we're all hoping that with the border closure, the numbers, if it happens, will be limited. And so far, there is none officially registered in either Syria or Yemen.
Yeah, you were just mentioning isolation a moment ago. I mean, there's this idea of social distancing, that people should keep a distance from one another when it comes to coronavirus. But when you look at the situation in a refugee camp, in whether it's in Syria or in Lebanon, often overcrowded, is that idea even plausible there?
Not really. It's very difficult. For example, in Idlib recently, we did a study with Harvard University, and we saw that some camps increased in size by 100% and 177%. So that's additional people coming to live in very small areas, overcrowded areas, as you say. And these are tents. So social distancing isn't really possible when you have 4 or 5 families sometimes living in the same space. In Lebanon, it's the same. Informal camps, 40% of informal camps rely on water trucking. So if this water is not delivered to them daily, it's impossible for them to maintain any levels of hygiene, acceptable hygiene. So the camps are the most difficult settings to handle any outbreak of the sort.
I'd like to talk to you about Lebanon in just a moment. I'll come back to you. But over to Claudia in Rome, because we were talking about the number of cases in Libya, and you were saying that there were none so far. But might there be some cases going underreported? Because some international experts, as well as observers, are saying that, for example, in countries in Africa, there are a relatively low number of cases because that's the result of poor reporting and low testing rates. That's one theory. So could that be the case in Libya?
Sure, it is plausible. What we've seen, however, so far is suspicion of some cases in one specific location in eastern Libya, and authorities say dismissing that as not being a case of coronavirus infection, but they brushed it away as some other animal-related infection. We don't really know whether this is true or not, but certainly there is the risk of the virus existing and not being detected. There's also the risk of few Libyans returning from trips abroad. We've seen officials in Syria. We know of Libyans also returning from Italy and so on, bringing the virus into the country and not showing the symptoms until much later. But, compared to other conflict countries, Libya has an advantage. I mean, compared to what we were hearing before about Syria, Libya doesn't have refugee camps. It's a very vast country, a very small population. We're only talking about 6 million people that traditionally already have a very conservative way of living. Very much, life is very much centered around the house.
What is the public messaging?
So we don't have...
Right. What is the public how important is the public messaging side when it comes to coronavirus in Libya to sort of avoid a large scare?
Some officials have gone public saying that if the virus were to hit Libya, they are unprepared. But overall, my feeling is that Libyans themselves are very much underestimating the dangers of this virus. People are still sort of almost joking about it. In some cases, I receive messages of people saying, Corona is too scared to come to Libya because the war, so we intimidate the virus. So there's still a very humorous sort of attitude about about the virus, and people are not taking it really as a serious threat or something that will affect them. But looking ahead, I think authorities should consider putting in place measures to stop what are the main public gatherings that take place in Libya. One is funeral, and the other one is weddings. Really, these are the only two public moments where you see a concentration of people in a given site. So if they want to really stop the potential spread of this virus, they also should consider taking measures in these two domains.
Right. And these measures, Joelle, have indeed been taken in Lebanon. When you look at the situation in Lebanon, of course, it has been a war-torn country. Today, how high is the risk in Lebanon with the state of the health infrastructure and the hospitals affected by years of war?
I mean, there are two different things that as Save the Children we work on in Lebanon. We work mostly with Syrian refugees. It's the country with the highest per capita refugee number in the world. So Syrian refugees who live within poor communities in Lebanon, because this is where they can afford to pay rent, are in close contact with the Lebanese population. So far, we have not registered any case of a refugee that has tested positive for corona. And then you have the informal camps, for example, in the Bekaa Valley, which are quite isolated by nature. You know, they are built on agricultural land, and where the refugees often don't really mix with the surrounding population a lot because of sometimes paper issues and legal residency. So for now, as an international agency present in Lebanon, we're keeping an eye on any outbreak among the refugee population. As for the Lebanese society, because there's been several cases, up to 100 plus, registered in Lebanon, the Lebanese government and the authorities are handling this side of the response, and international organizations aren't really asked to support so far, as long as the public system can face the outbreak. And we're hoping that, we won't have to step in. But obviously, we're also in touch with the Lebanese authorities for any contingency and emergency planning.
And to what extent are countries like Lebanon and the work that you do, particularly with Syrian refugees, relying now on international funding? And what kind of response are you getting from the international community when it comes to your work in coronavirus?
Yes, I mean, for either Lebanon or, for either Syria or Yemen, every year there's an international pledging conference where donors from around the world come together to pledge help and support for Syrians and Yemenis. And this year, the Yemen one is on April 2nd, so in a few days' time, and it's supposed to take place in Saudi Arabia, but we still have not heard whether it's going ahead or not. The Syria one is now in June in Brussels, again, at the heart of Europe. And we still are waiting to see if people will actually be able to physically go and pledge support for Syria. So these are important moments for us where the international community and world leaders come together and come with financial support. And if these are threatened by the outbreak, or if national funding needs to go to countries to support with the corona response, we will see an impact on the humanitarian response in both Syria and Yemen. And this is something that is very worrying for aid agencies.
Claudia, would you like to weigh in on the issue of international funding when it comes to Libya and coronavirus? Of course, the international community has played huge roles in Libya.
Yeah, I think the problem in Libya is different. It's not so much an issue of curbing international funding. In fact, the international community doesn't really fund that much because Libya is still considered a rich country, an oil-producing country. So the conflict, or the humanitarian side of the conflict, only receives marginal funding from the international community. Where the impact is going to be greater is on the peace talks. As you might might recall, talks have been ongoing, mediated by the UN since late January. These have floundered in many respects, but there's still a keenness to keep them going. Now, with the corona outbreak across the world, the chances of having these diplomatic meetings have reduced. The international engagement on Libya has reduced as key countries, including Italy, have their mind elsewhere. So I think the big impact of the corona outbreak will be sort of reducing or closing the windows for opportunity to push for negotiations and also divert the attention away from Libya of key international actors, which include the UAE, which include France, away from Libya and into their own domestic problems. Right. This will be the problem.
Okay, we'll have to leave it there. We thank you very much for joining us, Joelle Bassoul from Beirut and Claudia Gazzini from Rome. Thanks for your time. And earlier, of course, we were joined by Dr. Ihsan Aidi from Idlib in Syria. Thanks for watching. You can see the program again anytime by visiting our website, aljazeera.com. For further discussion, you can also go to our Facebook page. That's facebook.com/AJ Inside Story. You can join the conversation on Twitter. Our handle is AJ Inside Story. From myself and the team in Doha and in London, bye-bye for now.